Turns out a child's weight has a lot to do with mom. A new study found that a child's weight loss and gain is linked to how mom, not the dad, puts on the pounds. Here to explain is Dr. Richard Chaffoo. Dr. Chaffoo, good morning.
Good morning, Shally.
This is an interesting new study.
Shally, it's a fascinating study that just came out of the University of Norway, and they actually, of all the studies, it was an 11-year study that looked at 4,400 children and their families, and what they found in the study was that there did seem to be a link between a mother's weight gain or weight loss and the child's weight, and similarly the activity level.
So when you talk about versus a mom and a dad,
yes,
because we've heard this, whether it comes with the hair on your head or whatever
exactly.
It is, who you pick it up, it's the mom.
Well, it's the mom, and it's probably, Shally, because if you think about it, in many families, the mom's the one that organizes the activities for the children, helps to plan out the days or the weeks. Certainly in my family, that seems to be the case. And then also does the meal planning. And so if a mom decides to lose weight, at least in this study in Norway, then she would make those similar changes in the diet would affect the entire family, and similarly with activity levels.
So this is a lifestyle
It's a lifestyle.
Thing. It's not
exactly.
like an
It's not genetic. Correct.
Interesting.
Yes.
And it's true. I was just having this conversation, I was telling you in commercial break last night with my family. I'm in control of what my kids eat, what my husband eats, what I eat, what a lot of us eat. So
yes.
this makes sense.
It does. It does. In fact, the researchers also found, interestingly enough, that when there was extreme weight loss, this was not reflected in the children. And extreme weight loss would be situations where there's been an illness or when the mother simply wants to lose weight from significant dietary restrictions. She's not going to impose those upon her children.
And so when you say this and we correlate this, and when we're talking about lifestyle changes, this is the direct correlation to mamas?
It is.
Because of the way that we're planning things?
Yes, exactly.
All right. What about like BMI and any of these things? Is all that just correlated to activity levels and the food that they're eating?
Well, it is. And what the researchers also found, interestingly enough, is when we correlate BMI and being overweight, there are certain what we call factors for flourishing that seem to be diminished. So children's ability to finish tasks, homework, completion learning, the ability to remain calm in stressful situations, their interest in academic performance is directly related to their BMI. So in other words, the higher the BMI, the less likely the child is going to actually perform that well in those activities.
Oh man, I was trying to blame all that on my husband. So it's really
well, I think we're in the clear, fortunately.
But when we talk about child obesity, Dr. Chaffoo, interesting that we're talking about this today, because I was just having a conversation last night about how much our kids eat, and sometimes we just can't keep track. It's just the day is
very
so
difficult
fast.
to track it, yes.
And we just looked it up. Children between the ages of 2 and 18 should eat fewer than 6 teaspoons of added sugar.
Right.
That comes to 25 grams of sugar. Open your refrigerator right now. Open it and look at how much sugar is in a chocolate milk, regular milk, yogurt, yes. All these things.
And foods we wouldn't even think that they're in because it makes them more palatable. And you're right, and that's part of what contributes to the overweight issue that we have in children. We know the health risks, obviously, for a child being overweight.
Yeah.
Now we can see it has significant effects on their academic performance and potential future.
Give me some advice as a parent who could be watching this right now and this light bulb goes off. What do you do with this information?
So I think the important thing, Shally, is realize that you are in control, that you need to do your research, look at the foods that you are eating, first of all, and make sure that you're making healthy lifestyle decisions for yourself, and make sure that if you make those changes yourself, at least in the study from Norway, those changes will be reflected in your children. Increase your activity level, get more active. Your children are going to get more active. They watch us more than we think that they do.
Yeah, they do. We were at Disneyland last week. My daughter heard somebody else talking about a cupcake. She's 2.
Right.
On the other side of the room. And she turns around to me, she goes, "Mommy, I want a cupcake."
Exactly. It's like a laser.
It's like a laser.
Beam. My 3-year-old daughter the same way.
Okay,
they don't miss anything.
No, this is a good reminder. It's a good reminder. Dr. Chaffoo, thank you for being here.
Good to see you, Shally. Thanks.
Good to see you. 7:45.